Kenyans seeking treatment and medical services in public health facilities will be forced to look for alternatives after nurses and clinical officers, healthcare workers who are critical in the provision of healthcare, made good of their threat and downed tools on Monday. Clinical officers under Kenya Union of Clinical Officers KUCO and nurses under the Kenya National Union of Nurses KNUN have accused the government of treating them to empty rhetoric since May without taking serious action, despite planned industrial action that has frequently been suspended to give room for talks.
This is to confirm to all the public servants or the nurses working in all public facilities that the strike is on and all the nurses are at home, working now from home.
KUCO says it has lost 9 clinical officers to COVID-19, including a 32-year-old who is yet to be buried due to a high hospital bill that has not been cleared, a clear indication that frontline health workers do not have sufficient medical cover in times of need.
And you can just see the priority. At a time when we are revising our constitution and having had more than 100 strike notices over the last 7 years, they never saw the need to remedy the situation in the health sector. If you just do a spot check in hospitals, you will not find a single one of us having an N95 or a face shield. And that is the reason as to why you are seeing the surging number of medics who are getting infected and also dying. We have a case of a very young clinical officer from Nandi County, Victor Tioni, 32 years of age, with a very young family, very young kids, who actually died last week from COVID, was admitted at St. Luke's, now has a bill of 2 million that we are actually contributing to be able to offset. Yet on the other hand, you see the CS on public media saying that they have procured a medical cover, but yet we have examples that they have not actually been able to cover. And this is what we are saying, that we can no longer take this rhetoric.
According to KUCO Chairman Peterson Washira, at least 763 clinical officers in public and private facilities have been infected by COVID-19 since the outbreak of the pandemic.
The government has neglected health workers. I know most questions have been asked in the media is why strike at this time? And my question is why BBI at this time? They have taken billions of Kenyans' money to BBI while they have left Kenyans to die. And what we are saying as healthcare workers is this: we are not going to commit suicide. If we are not provided with the right protective equipment, we are not going to agree to work.
Si mambo mageni, si mambo tuliamka jana tukasema tunahitaji kufanyiwa jambo fulani na fulani. Ni mambo ambayo tumekuwa tukisema siku nenda siku rudi. Lakini kwa ajili wao priorities zao wameweka kwa mambo ya BBI, basi waendelee na BBI. Watakapomaliza watakuja wapate hata hao wa Kenya ambao wanataka kuwatumia na hizo kura zao hawatakuwa.
The reason as to why they're engaging people on these exploitative contracts is because they wanted numbers. So we have a government that does not care about the health workers. It cares about delivering on the other side, so health workers can go to hell.
Good afternoon.
Doctors under the Kenya Medical Practitioners and Dentists Union KMPDU had also threatened to keep off from their workstations beginning December 6th to protest lack of adequate PPEs in hospitals and medical insurance cover, particularly to those in the front line fighting COVID-19.
Results of this meeting today and engagement.
The Union Secretary General Dr. Chibanzi Mwanchonda, however, on Sunday night, suspended the strike for 14 days, which elapses on the 21st of December, following pressure from the Labour and Health Ministries and both Houses of Parliament. The striking healthcare workers are also lamenting that the sector has been highly politicized, wondering why the government is championing for the BBI at the time the health sector is on its deathbed. Dickens, Luvanda, Hope TV News Watch in Nairobi County.